On this episode, I'm sharing some timeless and timely words of wisdom from a few of our trusted public health leaders and colleagues to help guide us forward as a public health community. You're listening to the PHEC Podcast, episode 432. Welcome to the Public Health Epidemiology Conversations Podcast, where we dive deep into the topics that matter most to public health professionals creating change in communities around the world. I'm your host, Dr. Charlotte Hughes Huntley, and today it's just you and me as we explore a topic that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. I'm intentionally interrupting the chaos that is likely flooding your newsfeed to bring you this episode of encouragement. Well, my goal is that this episode will encourage you. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, trainings, and we're ultimately helping our clients communicate their health information in plain language to the community partners as well as the broader communities that they serve. The support we provide often falls in categories of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. Links are going to be provided in the show notes. Reflecting on the conversations I've had with guests on this podcast this year, a few themes really stand out, especially as we think about the challenges and opportunities facing public health throughout this year. This is 2026 at the time of this recording. From collaboration to innovation and communication, our guests have shared wisdom that feels both timely and timeless. So in this episode, I want to pull together some of those key insights and quotes to highlight the strategies, encouragement, and lessons that can feel supportive and encouraging and help guide us forward as a public health community. Now, as a disclaimer, this was very difficult to narrow down and put together, so there may be other episodes in the future where I bring together some of these highlights. So if you were a guest and you're thinking, well, what I had to say was really strong, you're right. I just had to somehow find a starting point. So I don't want anyone to feel like these are the only insights. These are just what I decided to start with. Okay, in no special order, I'm just going to share a few of these with you. And keep in mind that links to the full episodes will be provided at the end in the show notes, and I'll tell you again how to find that toward the end of the episode. So the first key takeaway insight that I want to share with you, theme that emerged, is strengthen your network and foster collaboration. So collaboration is a source of resilience. Lock arms with like-minded colleagues. We heard this many times. And reignite the collective thinking. So we had a guest, Dr. Oscar Allen, who's been on our podcast multiple times. Actually, he's the only guest who's been on 3 times. But I invited him back for a special conversation back in episode 406. And he advocates that we lock arms with like-minded colleagues who are focused on health. And that's how we gain our strength. I wholeheartedly agree with that. And I've said that multiple times myself throughout the year. I have this image, of all of us locking arms because we are much stronger that way. Also, true leadership means vulnerability, asking for help when needed. So we had Commissioner Danette Smith on episode 412, who highlights the need for broader partnerships. She even talked about going to someone, just kind of quoting her. She said, going to somebody that I would not normally go to, saying, I'm going to need your help to do the thing that I need to do. So that was really a strong statement that resonated. True leadership means vulnerability. Community support can often come from unexpected places, sometimes even strangers. So we had Dr. Nicole Vick in episode 408, who shared a very personal experience regarding community support. She said the amount of support that I received was overwhelming. People that I met on LinkedIn and I did not know prior literally showed up for me. So again, her personal experience with the power of the connectivity in the community. And this community on LinkedIn she's referring to as her public health community. Also, diverse perspectives can lead to stronger, more impactful solutions. Now, Megan Weiss raised this in episode 411. She points out the value of diverse perspectives. She said, anytime you can have the diversity of thought and experience coming together, you can make better decisions and really have that positive impact. So, all of that to summarize this theme of strengthening your network and fostering collaboration. I'm speaking to some people. I have some people in mind because I have a few of my colleagues that I've been kind of tapping them on the shoulder because they feel like they have to go this alone as if they are individually charged with solving these problems. And that's not the case. And that's a quick route to burnout. So strengthening your network and fostering collaboration. All right. The second real key takeaway or theme is really master effective communication. I have been really leaning on this one personally. And if you've been listening to the podcast, you know, but really mastering effective communication. So Abby Tai in episode 417, all of these episodes I'm going to share with you in the show notes, but make sure if you've missed any, this is a time to go back and listen to these full conversations. They're phenomenal. But she explains public health needs to go back to zero in explaining who we are and why we matter. I have been saying that over and over and over. In fact, that has everything to do with why we launched this new series, What is Public Health, which is really helping us to break it down in plain language and sharing these stories so that we are really explaining who we are and why we matter in a way that's effective. Use storytelling and short, clear messages. Data is powerful, but only when understood. So that comes from Dr. Oscar Allen, again, episode 406, but it's aligning with that same message of going back to zero, as Abby said, and really making sure that we're clearly explaining who we are and what we do, why we matter, and know your audience and adapt the message. This is a part of that What is Public Health series that we have, adapting your message. I also recently led a training about this with the group, and I won't go on a rabbit trail on that, but a big part of my examples in that training was about how to adopt your message for who you're speaking to, the audience. So show how public health touches everyday lives. Dr. Michelle Taylor in episode 404, as well as Megan Weiss in episode 411, and also Allison Rapp in episode 410, all touched on the same theme, the same topic of knowing your audience, adapting your message, and how public health touches everyday lives. So master effective communication is a huge theme that emerged, and it so aligned and resonated with me and my personal mission and values and what we stand for. Even as a consulting firm, what we do is, you heard me and you hear on every episode, I explain to you what we do as a consulting firm. Like communication, effective communication is highly important. So this is something that has been emerging over these episodes, a theme of mastering that effective communication. These are things that I think of as empowering us individually. It doesn't matter what you do, who you work for, what your restrictions are. You still have the ability to incorporate some of these, like this communication skill, and practice that and master that and implement that. It doesn't have to do with where you work and what your role is. This is something that we can all do. And just kind of pointing out how significant and important it is right now in the times that we're in. So the next theme that I want to share with you is embrace innovation and seize opportunities. So I have a few examples here. I guess if there was ever a time to embrace innovation, it's now. And there are so many opportunities. There always have been, but now more than ever. So current challenges create openings for progress and even new models. So in episode 409, we had Dr. Scott McNabb, who joined us to discuss a great example of innovation and even how we address surveillance. So AI, data modernization, tech tools can advance surveillance and improve efficiency. So he gave a great example. If you haven't listened to that episode, that's a great one to inspire some innovation. Maybe tap into your own innovative thoughts and maybe give you the courage to step out and really start to speak about some of your ideas that you have, because the opportunities for those ideas to take root and really for you to take action on them are really plentiful. We also had Abby's example, episode 417, just to think of this period as rebuilding the foundation of public health. Her episode talks about her journey being fired by this Trump administration from CDC and what it inspired her to do. So she's an example also of innovation and seizing opportunities. So that is a theme that emerged in several conversations, but those are just a few examples to highlight right now for you. Another theme to take away from some earlier episodes of this year, be strategic in career navigation. So my primary person for an example here is Zoila Reyna, and that was episode 405. I invited Zoila to be my guest on this episode because of all the massive firings that were happening at the very beginning of the year and people that were looking for jobs. And I thought, well, she's a great resource. And I brought her on to have the conversation and really share. So she really talked about being strategic in career navigation, following the funding shifts, philanthropy, corporate social responsibility, and the ever-evolving well-being frameworks. Zoila talks or advises public health professionals to be following the money in 2025. And that really goes for any year, but in this year of all the massive things that are shifting and dropping and being gutted out and changing, she said, be following the money, suggesting focus on philanthropy groups that are funded by private donors and corporate social responsibility or social impact, and funded by large corporations that are for profit. So that's what she means by that, following these funding shifts. And she talked about it quite a bit in that episode. She also talked about using transferable skills, focusing on transferable skills like coordination, collaboration, stakeholder engagement, scaling best practices, and advocated for being open to things. So they may not look the way you've traditionally seen them or thought of them. So she really provided a great bit of value on that episode. So I really encourage you, if you have not heard that one, episode 405, it's really about being strategic and career navigation, and then following up with her because she is an excellent resource. Okay, another theme takeaway that I like to share with you is be strategic in advocacy. So we have a few examples here. This really stay civically engaged, speaking with your legislators and following priorities of elected officials, and engage even with local media. So both of these episodes were earlier in the year. And then I also attended Policy Action Institute, and I talked about that on yet a different episode. But this emerged and was reinforced over multiple conversations after the two I'm going to share with you. So this has really become a strong theme, being strategic in advocacy. So Dr. Oscar Allen, episode 406, points out that individuals have the ability as informed individual to both take that collective step of increasing your awareness of how things function, how programs are supported, and where the priorities are of those elective officials. So it's really important to, on the local level, and he made it what I felt like really actionable and manageable because everything feels so overwhelming happening from the administration down on a federal note, but really leaning into what's happening locally and figuring out what those priorities are of your local elected officials. There's a lot of strength there. Dr. Deanna Wathington in episode 399 encouraged engaging with legislators. She said it makes a difference. We need to speak to our legislators, especially as we move into this new era of rebuilding public health. The more of us that speak in that matter will help move the ball, as she said. So those are two great episodes to refer to, but the theme of being strategic and advocacy is really powerful and kept being reinstated throughout multiple conversation across several months of the podcast. And I think that letting that mull over and back to kind of overlapping with some of the other themes of collaborating with others, you'll kind of find a place to lean into this advocacy, whatever that looks like and feels like for you, feels good for you. Okay, I have a few more to share. Another one is prioritize self-care and vulnerability. Take intentional breaks and set boundaries to sustain longevity in this work. So this is something that we've heard so much of, prioritizing self-care and vulnerability. But I really want you to not tune me out here, but to really listen carefully and consider this. All right. So Dr. Michelle Taylor in episode 404 talks about, or she emphasized the importance of budgeting and mental health for job seekers. Well, really anyone, I think. She said, please take time to take care of your mental health, emotional health. that this is a lot to process. Everything that's happening is a lot to process. And trying not to take it personal, although it's very hard for us not to take it so personal. So in that episode, which was earlier in the year, things were at a different place than they are. We're in the summer. And then, of course, now at the time of this recording, it's toward the end of the year. But I still think that this is still very relevant. Taking these intentional breaks and really being able to budgeting your time and boundaries around mental health. There is a lot happening from the earlier part of the year to now and continuing on. It seems like there's always a lot happening. There's all these little fires burning around us. And it is difficult to not take it personally because we are very impact driven and we care so much. We're very passionate about the populations we serve and the work that we do. So it's really difficult not to take all of these dramatic changes personally. But I definitely understand her point, and that's something for us to really consider. Danette Smith in episode 412, she shared a time where she took off. So she really advocates for taking intentional time off for self-reflection. And she shared her own personal example of that, how she took some time off and that reflection and the outcome of that. She said, as a result, she reset her boundaries. And I say reset instead of set boundaries because I'm sure she had boundaries in place. But for a lot of us, we need to understand that those boundaries may not serve us very well right now. So resetting those boundaries whenever we need to is something that we all individually need to be aware of because we can only do it for ourselves. So she said, I've decided that my weekends are for me. So Danette Smith is commissioner of behavioral health in the state of Colorado. So when you listen to the episode, you'll hear more about specifically what she does and her background. And she, as a lot of government employees, have worked, and a lot of us just have worked weekends, and our work time and personal time, those lines get blurred sometimes. But she said, I've decided that I need to take back my weekends. They are for me. And if I need to do something for work, I get up early in the morning, get it done. But my weekends are for me to be able to rest and rejuvenate. And that's important. I really appreciate that. So that theme of prioritizing self-care and also vulnerability, because, Danette talked about true leaders, in order to be a true leader, it requires vulnerability. Those go together, and those two really resonated and surfaced up quite a bit in multiple episodes. But those two are great to get started if you haven't heard them already. Okay, maybe one more, and then I'll wrap up. But find your power and speak up. So everyone has a lane. Identify your strength and use it as your contribution. This comes from Dr. Nicole Vick in episode 408. I really like the way that she phrased it and framed it in that episode, in that conversation. Just being able to find your lane. This is from her. She said, because I think a lot of times we feel helpless, like, I don't know what to do. But she's like, yes, you do know what to do because it's that thing that you love to do and you do all the time and you're really good at. That's the thing that you should be doing. That's your lane that she's talking about. So she talked about how you can lean into that, and there's a lot of power there. She said silence is not an option, but speak up in your own way using your unique power. So don't feel like you've got to speak up the way someone else is or doing what somebody else is doing, but she really talks about once you identify that lane, that thing that you're good at, that you naturally do, like understanding that there's power there and speaking up and leaning in that way. She said, in this space right now, we can't afford to just let things happen. We have to speak up. But you can do it in the lane that you've chosen and operate in that way. That was a great example and a great way. I think if you listen to that episode, it may resonate with you and it may inspire some of your own thoughts about how you can find your power and recognizing where your power is. I think it's easy for us to feel powerless in the times that we're navigating. But this episode and these conversations help you recognize and remember that you do have a lot of power. So public health is definitely, we have been facing challenges without question, without doubt, but we're all playing a role in moving public health forward. My hope is that these takeaways and insights inspire you to keep going, to speak up, and to connect with others who share this mission. Together, we can navigate the uncertainty and build something even stronger for the future. Links to full episodes that I mentioned here can be found on the show notes page. Now, the show notes page for this episode, which is episode 432, can be found at phecpodcast.com. Once you're there, just navigate to episode 432 to find the show notes. One more thing before we go. Remember that our podcast now has an app where we can continue the conversations from episodes like this one and connect with public health professionals around the world. You can download our PHEC Podcast Community app for Apple or Android devices from your mobile store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.